I have this pain and swelling in my hip and groin area. The pain seems to get worse the longer I exercise, but it tends to get a little bit better when I'm resting. My pain seems to have started around the same time as I upped my activity level, and I can't recall any fall or injuries specifically that led to this pain. Now you may be thinking to yourself, boy, that does sound familiar. But that still doesn't tell you much as what's actually going on. So I'm sure you're still wondering, okay, but what does it actually mean? Well, it means that we need to be careful when diagnosing what's actually going on, and we need to investigate for a possible femoral neck stress fracture. The picture below is showing the anatomical makeup of the hip joint, or where the pelvis meets the femur. The femoral neck stress fracture actually occurs where this arrow currently being drawn is pointing towards. This is actually an example of a complete femoral neck stress fracture, which is what we're trying to avoid with early detection of these more minor stress fractures. But now I'm sure you're thinking something along the lines of, how could it have happened to me? I'm healthy, I'm fit, I didn't have an accident. As an active individual, it's more likely that we're looking at a fatigue-related stress fracture, commonly a result of an overuse injury or repetitive forces through that joint. And these types of injuries are often seen in athletic populations or just active individuals such as long-distance runners, athletes, military recruits, or people initiating in a new exercise program or just hobby that requires an increased level of activity. And as you can see in the picture above, running would be a repetitive force constantly on that hip joint articulation as you load the joint with forces with each individual step. Now that you have an idea of what's actually going on, I'm sure you're wondering, how can we confirm that it's an actual stress fracture in you, and what does this ultimately mean for me long term? To confirm that it actually is a stress fracture, you will need to have an X-ray or an MRI, but before you leave the clinic today, your therapist may have you complete some special tests to confirm the suspicion of a femoral neck stress fracture before you head out to the doctor. Now let's take a look at what this actually means for you in terms of returning to your activity or sports before the injury. Once the femoral neck fracture is actually confirmed by an MRI, the results will indicate a couple of things. These results will tell you which type of fracture, whether it's a compression side stress fracture, which has better prognosis for recovery and the use of conservative treatment, or a tensile-sided stress fracture, which often requires cervical intervention as the bony articulations don't seem to heal as well. Now let's take a look a little deeper into your treatment options. There are two routes that are commonly taken with stress fractures here, which include surgical and conservative treatment options. The surgical intervention is one that is usually required in patients with high-risk stress fractures, or the tensile-sided stress fractures as we previously discussed. Surgery usually entails screws and plate fixation to ensure bony healing of those tensile-sided stress fractures. Unfortunately, due to the severity of this type of stress fracture, return to contact sport is atypical. However, a return to running and other activities is expected. Now to discuss a little bit about your conservative treatment and what it would include. Conservative treatment or physical therapy will often begin with proper use of crutches or assistive devices, as well as exercises to maintain proper movement patterns and increase strength. Your therapist will also talk to you about modifications to any activities that may be aggravating these symptoms. Patients can expect to return to activity in 12 to 18 weeks. I hope you found this video both helpful and informative and wish you the speediest of recoveries.